Hey everyone, just chilling out in the car with my dog here. She, I don't know if you can see her, she doesn't want to get out of the car, and we went for a car ride, so we're just hanging out in the car for a little bit. I know people have been asking for an update. I have not updated a lot. Sometimes I just don't even really know what to say. There isn't a lot to update on a daily basis. So basically where we're at is I had the nerves burned in my back and it hurt like hell. I was put to sleep for it. They did do the nerve block with it. I can't explain a whole lot about the procedure. It's the first time ever doing it. There's not supposed to be a ton of side effects with it, but then they said the doctor's office said it can take a couple weeks for recovery time for pain and just being uncomfortable around the site. So it's been 2 weeks. I go back on the 30th, which will be 3 weeks after it's been done. So anyway, I had the pain with it. The pain has subsided, so it's a lot better. However, I have very, very bad burning sensation inside my back and just touching it. So the back itself is numb. And what's weird is I had a lot of pain and discomfort with it, even though the back itself is numb. Then that part went away. So doing well with the healing process. However, now I have this horrible burning sensation, so it feels like I have a really, really, really bad sunburn constantly in my back. So wearing a t-shirt, wearing this jacket, anything makes it a lot worse. I've tried ice packs, I've tried just so many things, and those things that I have tried have made it worse. So an ice pack is totally out of the question. Before the ice pack, when I was just having some discomfort with it, they had told me originally alternate ice and heat, so that's what I was doing. And I did a heating pad and burned the back. Not really bad, like it was just like a burning sensation and it had turned red, so it wasn't bad. By the next day it was fine. But so the heating pad is totally out of the question. Probably I couldn't feel it, what was happening to it, much because the nerves are burned. But anyway, the heating pad did provide some relief at times, but this one particular day I made it worse. So anyway, now I just have the constant burning with it, not because of what happened with the heating pad. It's just I don't know what it's from. But anyway, there is no redness, no swelling, nothing like that, no infections, no fevers, etc. It looks great. You can't obviously tell by looking at it. You touch my back and I'm going to scream. Laying down, going up against the car seat here. I have a pillow behind my back. You can see it here. I went and got a pillow and have that behind my back because I cannot lean up against the seat in the car. I actually called the fire department and went over it with them because I needed to know the distance in the thickness of the pillow that I could have to where the airbag in the steering wheel is. So it is a safety concern, just like having a child in a car seat with a thick winter jacket. You don't want to do that. They have to wear a thin jacket. There are jackets made specifically for winter that you can use for kids that are safe in a car seat. So it's kind of the same aspect. So we had to go over that to make sure that I was okay with the thickness of the pillow and the distance from the steering wheel. Then so my bed. So you guys, if you've been following, you know that I have a bed that I purchased, I think it's been about a year now, I'm not even sure, but I had purchased it sometime last year, and it is a bed that I can elevate the head, the feet. It does have a massager in it. I don't use the massager. Honestly, I did not even know that was in it when I had purchased it. However, I did try the massager once when my back was hurting bad, and it made it worse. So that's out of the question. There's 3 settings on it, and even the low setting, forget it. So that's completely out of the question. Then the bed does have a cooling thing with it. The reason I bought the bed is because it was designed for people that have cancer and radiation, that have the burning from the radiation and the chronic pain and stuff. So there's the mattress that was designed for this bed. It was designed for cancer patients. So that was the main reason why I had purchased this. So the mattress and the bed frame, like, it all came together. And so laying on that, even though it has the cooling piece to it, so when I lay on my back on it, I can feel the coolness on my back, it's still not enough. So, and it's hard to just lay on my back. I have to slowly lay down. I can't just lay down. I can't just lean up against the back of a couch. Taking a shower is very difficult and challenging because the water hitting my back. So there's a lot of challenging things and a lot of things that I've been dealing with because of this. However, I will say it is worth it for anyone that needs to have this procedure done. I don't remember what it's called. It's, I think, RF something or other. Radio frequency ablation, maybe, RFA. I don't remember. Don't quote me on that. But anyway, it is definitely worth it for someone that has chronic back pain. It does not mean that you're going to have the burning sensation and go through the stuff that I'm going through. However, I seem to fall in like that 1% of people that, you know, if it can happen, it's going to happen to me. So I'm kind of that lucky person. Anyway, so it doesn't mean you're going to have this. A lot of people have no issues with it at all. So, and it can last for several months. It can last up to 2 years, is what I was told. Your nerves can regenerate. They can grow back together, if I'm saying that properly. Anyway, and then people may or may not have to have it done again. So, luckily for me, my back is still numb to the touch, but the burning is really bad. So it's not painful. It's just really, really bad burning, like a very bad sunburn. So I've been dealing with that, which has been tough. It's been difficult in every aspect, 24 hours a day. I wake up from it. It's just a lot that to deal with. So stomach, I haven't been having a lot of the stomach pain anymore. The doctor did start me on a new medication as a trial, and I don't remember what it's called, but anyway, it has been helping, and it's very difficult. I was told that sometimes to get the insurance to cover it. Luckily, they did the pre-authorization, filled out whatever they had to do. The insurance did cover it on the first try, and I think, if I remember correctly, it was 3 months that I had gotten. So hopefully they just keep refilling it for me, because it is working. Then I am seeing a dietitian on the 20th, this Friday, because I want to go over do's and don'ts of what I should or should not be eating that can help my stomach even more. So I'm still having a hard time with eating. Sometimes I have no appetite. Sometimes I just don't even have a desire to eat. You know, I don't care. Other times, like, I'm hungry, I want to eat something, I can't get it down. It's like it's stuck right in here. Sometimes it comes back up. Sometimes it doesn't. Sometimes I can get it down, but then I'm getting sick again. So I'm going to meet with the dietitian and find out the right things to and to not eat and drink when it comes to having SIBO. I don't know a ton about it. I've got little education on it. Not saying that my doctor did not educate me on it. They're very good in the doctor's office. It's just that when it comes to diets, you know, they're gastroenterologists, they're not dietitians. So I'm going to meet with this lady and see what she can do as far as helping me. I've tried gluten-free, which is disgusting, by the way. I do not recommend it to anyone, but if you need it, obviously follow your doctor's recommendations. I am on the dairy-free as well. Like, I have the lactose intolerance now, which is fine because I don't eat a lot of it. I do like cheese, but I don't eat enough of it for it to cause an issue. However, I was eating cottage cheese with pineapple every day for breakfast, so I did have to put a stop to that. Otherwise, I'm not a milk drinker. I love ice cream, but, you know, I've just been very careful with that. So, hopefully that will help, and she'll be able to give some direction, maybe some recipes. I'll share some of the stuff with you guys in case there's anyone else that is having some stomach issues or sensitivities or allergies or whatever. So I'll post some of that on here. The 27th, I see the radiation oncologist. So I have a appointment with his nurse. I don't remember exactly what that's for because it's been a long time, but I believe it's to go over, to like update my records of things and go over stuff that I've had done with GI, dietitian, that kind of thing, just to update things. She'll take my vitals, all that kind of stuff, ask a series of questions about things. Then after that, I have the meeting with the doctor, and we're going to go over all of that stuff again, and then talk about the radiation. So he does, even though I hardly ever see him, he does keep up with my records. Everything from all the doctors do get sent to him and to my whole team. So everybody in my team does get all the information, whether it be the pain clinic, primary, oncology, endocrinology, respiratory, whatever, they're all getting it. The dietitian will be added to that list as well, so that everybody is up to date on the same page. That's kind of routine with things, but I also did ask for that to be done as well if it was not being done, because I need everybody on the team to be on the same page so that they can all help with a proper plan of care in every aspect of what I'm going through to help me be comfortable and stop complaining so damn much. So that will be on the 27th, and we hopefully will have an estimate as to when the radioactive iodine will be done. I'm thinking sometime mid to the end of November, because tests have to be done prior to that. So I need a PET scan, I need blood work, I need an ultrasound of the thyroid area. They'll be looking to see if there's any nodules or anything in there. Even when there is, it comes back negative for some reason, does not pick them up. I don't know why this is, but we're going to do that anyway. It's kind of routine, and then we'll have the lung cancer screening test. They are not looking for lung cancer. I do not have lung cancer. I have thyroid cancer, like in the lungs. But the reason for this is a CAT scan. The reason for this CAT scan, the lung screening opposed to a regular CAT scan of the lungs, is the radiation that is used. The radiation in a regular CAT scan, they're going to be using it, and I cannot have the radiation, especially prior to, it might even be the iodine with it. I'm not 100% sure. I'll know more for sure that I can update with stuff on the 27th. But the lung cancer screening does not have all this stuff in that CAT scan, so it makes it safer for me to have prior to the radiation. So otherwise what would happen is we would have to prolong the radioactive iodine longer to get everything out of my system as much as possible prior to having the radioactive iodine to make it effective. So there's, that's what's pretty much going on right now. I met with the fire department today. I did get paperwork from them I have to fill out. So if there is anything that you have that is a chronic illness, something that is a serious thing that you may or may not be needing them for a lot, or something that you have like cancer, radiation, things like that, there's something that you can fill out to notify them. So I did get that today. I don't know if you can see it here. So I'll be filling this out for the fire department here so that it will be on their records, and they will know what's going on as far as the radiation. Then the doctor's office will fax them proof of the radiation, let them know that I had the radiation, how much, when I had it, etc., so that they know, so that if they have to be called for anything, they can be prepared of how they have to enter the home, help me, transport me to a hospital, and so forth. So this way they can make sure ahead of time before they are called, instead of being called and coming to the house finding out that I'm radiated, and now it puts them at risk as well. So I'll be filling that out today and dropping that back off to them so that it's in their system. It is only with them. They do not have access to other systems within different fire departments. So like, for example, if you go to a pharmacy, you get meds filled, a lot of times they can pull up other pharmacies. When you're in the hospital, you know, we have a program called Epic. We can pull up other things from different hospitals. They don't have that with the fire department. So you would have to do it with multiple fire departments depending on where you live. I am only doing it with the one in the town that I live in. I'm not doing it with other ones or with the town that I work in. So you know, it's important that it's at this one, which is right around the corner from my house more than anything. So that's what I will be doing today. And other than that, it's just trying to build up energy and strength, build up my immune system more, trying to be more active and exercise and do stuff now that I don't have all the belly pain. However, then there's the back issue because I have to be really careful with that because of how bad it feels. But so that's the next thing that I'm working on right now. But so that's my life. It's taking a big toll on things where it's limiting a lot of my activity and things that I'm not able to do currently. But you know, just trying to get through. Some days I'm extremely emotional and not happy, and other days I handle it a lot better. So that's where we're at today. So I will keep you guys updated. I will update you guys again when I see the dietitian. Thanks.